Hello, this is Bob Cook here from the YouTube channel TA Therapy. This is the third presentation on clinical supervision. Here I'm presenting my checklist, which I use when working as a supervisor with supervisees. So let's go to my checklist. I think of contracts and making sure that I've got contracts with all my supervisees. I'm thinking of the developmental level of each supervisee I work with. I'm always thinking of protection issues, thinking of how I enhance supervisees' professional development, and of course how I check for parallel process. Okay, so let's look at contracting and supervision. We have two categories: clinical contracts and admin contracts. Admin contracts are procedural contracts. That's things like how much the supervisor will charge the supervisee for the supervision, where the supervision will be, when and how it ends, reviews, and general procedures of supervision. The clinical contracts, that's what goes on in the actual sessions. Looking at the goals the supervisee wants, looking at how the supervisee might stop themselves achieving those goals. And actually contracts of review might actually go in there, but it's more really what the supervisee wants from the supervisor at an overall and sessional level. Okay, so let's go on to the next one then, which is really looking at the developmental level of the supervisee and how long the supervisee has been practicing as a therapist, because that will give a clue for the supervisor on how to pitch their interventions to the supervisee stroke therapist. So if it's a beginning supervisee stroke therapist, then the interventions will be very different for the supervision. For example, if it's a very experienced therapist, then it would be a much more collegial intervention, much more to multi-leveled or multi-perspective intervention, and it's a different flavour altogether than the nuts and bolts of the early therapist. So it's important that the supervisor has some developmental feel of where the supervisee is, so that there's a level of attunement for the effective supervision to take place. Okay, so let's go on to the next then. Protection issues. Oh, very important. At both levels, for the supervisor to see how the supervisee is protecting the client in terms of confidentiality, in terms of transference, in terms really of ethical issues, because the therapist might not realize they're being unethical, for example. So the supervisor is really acting as a gatekeeper here to see that there's a level of ethicality for the client in terms of working, and that the therapist is providing an ethical environment for the client to work in. And then, of course, there's the ethical side for the supervisee, that the supervisor checks out that the counter-transference of the supervisee is not getting in the way of effective therapy. Okay, so that's a very important area for the supervisee and the supervisor to be aware of. But of course, the supervisor holds that overall gatekeeping or protecting framework in the process. Okay, enhancing supervisee professional development, present and future. In other words, the supervisor needs to be concentrated on stretching the professional level of the supervisee. If the supervisee gets too cozy in the process, then their professional development might be static and not dynamic. In other words, there needs to be, I think, some reviewing system built in, so that the supervisor is always really stretching the supervisee and encouraging their development, often checking out at all levels, the educative level, the experiential level, that they're growing as a supervisee and not being stuck at a particular developmental level. Now, of course, contracting comes in here a lot, as I said, that there's talks about what the person wants from supervision and where they're going and sort of milestones on how to get there. So this needs to be checked out a lot, I think, by the supervisor. So there's a general level of progression happening rather than, say, stagnation. Okay, so that's an important one to look at. Another one, of course, is, to check out for parallel process, to check out the client-supervisee relationship or the client-therapist relationship and how that might be paralleled in the supervisor-supervisee relationship, and how, in fact, the supervisee-supervisor relationship might parallel the client-therapist relationship, and how you can use the parallel process to really have effective supervision. Okay, hope that checklist was useful and hope you'll listen again. Bye bye.